Monday is rated E for everybody.
All right, welcome back. All that sunshine might give us the vitamin D that we need, but we still have to put on that sunblock, especially here in Colorado. Joining us this morning is Dr. Joel Cohen with About Skin Dermatology. Thanks for being here this morning.
My pleasure.
I know it's gray today, but folks should always be thinking about sunscreen because it's a real danger. How does Colorado stack up against other states?
Really, 1 in 5 Americans will get a skin cancer during their lifetime. The rate is actually higher in Colorado due to our high altitude, outdoor lifestyles, and 300 plus days of sunshine every year.
What are some of the areas of the body people don't think of that really do become a problem for skin cancer?
We see skin cancer usually on sun-exposed skin, but we see a lot of skin cancer, really on the scalp, on the lip, on the tip of the nose, on the ears. So it's important to apply sunscreen to those areas, especially the ears, the back of the neck. Don't forget, wear a hat and really try to cover yourself extremely well in this Colorado.
There's got to be some places then that are going to be difficult for you to look or search for yourself. You're going to need some help, aren't you?
It's helpful to really look at yourself in front of a full-length mirror once a month and try to look to see if you have anything that's new or anything that's changing, bleeding, scabbing, getting larger, getting darker, crusted. It's really helpful for people who have a family history of skin cancer to go to a dermatologist at least once a year to get a skin check. If you have a personal history of skin cancer or atypical moles, you should really be going about twice a year.
Let's take a look at some of the photos now. Some of these things can be difficult for people to see, but they're also important to keep in mind. The telltale signs can be spotted well in advance in some cases.
So the first picture up on the top left is a basal cell. Those are pearly little bumps, oftentimes have little blood vessels on the surface. The second picture is a squamous cell, which tend to be more aggressive than basal cell and are crusted. And then that third one is a melanoma. The melanomas are usually pigmented, but not always. And we use the acronym ABCDE for something that's asymmetric or has border irregularities. This is a squamous cell carcinoma of the lip. These can be very devastating. These can spread to other areas of the body and be life-threatening. So it's important if you have something such as this that's crusted or scabbed to go to the doctor. This is a basal cell in front of the ear, a very common skin cancer, and this is a common area to forget to apply sunscreen.
Sure. I've actually had some skin taken off my ears because of that same problem. You really have to do it here in Colorado because they get so dry and so flaky, you got to keep applying it.
Yes.
1 in 5, sobering statistics.
Yes.
And we're higher in Colorado than many other places. Wear the sunscreen, wear a hat, and take a look at that full-length mirror and make sure if you want to check your scalp, you got somebody else that can help you, right?
And if you see the same person every month or two to get your hair cut, just remind them that you might have a family history or personal history of skin cancer, and
Sure.
if they see anything that looks worrisome, to send you in.
Use the barber or the salon. Dr. Joel Cohen, I appreciate it. Thanks a lot. Good advice. For more information on skin dermatology, log on to thedenverchannel.com. Click on the big red TV button. We've got a link there for you. And we'll be right back as 7 News Saturday Morning rolls on.